My name is Claudius Conrad. I'm the Chief of General Surgery and Surgical Oncology. I'm originally from Germany. I trained in general surgery at the Massachusetts General Hospital. I then did a cancer surgery fellowship at the Dana-Farber Cancer Institute. And then I focused my training on minimally invasive liver, biliary, and pancreas surgery. And that training I did in France and in Japan. I was a very young child. My parents introduced me to music, and it was an awakening even at that young age for me. My father has been a physician and introduced me for the first time to the role music plays in the life of a physician. And I explored this after I graduated from high school, and I could not decide between becoming a professional pianist or a physician, and so I kept both careers going. When a pianist performs on stage, there's a lot of stress and pressure. There's a mechanism that kicks in my mind that the more stressful the situation is, the more relaxed I actually become. I think that dexterity, a gymnastic component to being a pianist, that is covered by daily practice, that is just required to keep your fingers and your body moving at the level that is able to accommodate the complexity of the pieces. And there's a similar component to that in surgery, being able to tie knots at a certain speed, to be able to control your body to a degree that you're very sensitive to the feedback tissue gives you. We were one of the first groups who used scientific ways to try to understand how music heals. Then took it steps further and tried to understand the role of music in medicine in general. So we looked at the effects of music on relatives of patients, how it affects an OR team, the dynamics in the operating room, how it can affect the performance of surgeons, and what aspects of performance. And more concretely to my own performance in the operating room, I see a lot of similarities between being a pianist and being a surgeon. And a lot of the concepts I learned at the conservatory when I was studying are things I now pass on to my own trainees. While throughout cultural history, music has been an important part of healing, we have kind of lost this art recently, and I'm trying to bring it back in the context of high-end, innovative, modern medicine. We have investigated how we can find music that works the best for the most patients, and we have recorded our own music for patients to make it feasible, because it may not always be feasible to provide the patient with music of their choice. And in that context, we have a selection of music that works the best for the most, which is a selection of highly analyzed classical music.